What is bone marrow, and why is it important for leukemia? Imagine your body's blood factory, quietly working inside your bones. That's what bone marrow is, a soft, spongy tissue found deep inside bones like the pelvis, sternum, and ends of long bones. It's essential because it produces the blood cells your body needs to stay healthy. There are two main types of bone marrow. Red bone marrow is responsible for making blood cells, while yellow bone marrow mainly stores fat and contains stem cells that can develop into bone, cartilage, or fat cells. Red bone marrow is packed with special cells called hematopoietic stem cells. These cells are like tiny factories that produce three vital types of blood cells. The first are red blood cells, which carry oxygen from your lungs to every part of your body. The second are white blood cells, which help fight infections and keep you healthy. The third are platelets, which are crucial for blood clotting and stopping bleeding. Because blood cells are constantly being made and replaced, your body stays well oxygenated, protected from infections, and able to heal wounds quickly. Now, when it comes to leukemia, bone marrow takes on a very important role. Leukemia is a type of cancer that starts in the blood-forming tissues of the bone marrow. It begins when mutations happen in the hematopoietic stem cells. These mutations cause the abnormal white blood cells to grow uncontrollably. Instead of functioning normally, these cancerous cells crowd out the healthy blood cells. This can lead to symptoms like anemia, which causes fatigue because of fewer red blood cells, increased infections due to fewer healthy white blood cells, and bleeding problems because of a lack of platelets. Diagnosing leukemia often involves a procedure called a bone marrow biopsy. During this test, a small sample of bone marrow is taken from a bone, usually the pelvis, using a needle. This sample is then examined under a microscope to look for abnormal cells. The biopsy helps doctors determine the specific type of leukemia and how far it has spread, which is called staging. This information is vital for planning the best treatment approach. Bone marrow is also a key target in leukemia treatment. In some cases, doctors perform stem cell transplants, where healthy stem cells are introduced into the patient's body to replace the diseased marrow. This can help restore normal blood cell production and is often used in managing different types of leukemia. The success of these procedures depends on many factors, including the patient's overall health and the specific characteristics of the disease. In summary, bone marrow is the core of your blood production system, making it essential for life. Its role in leukemia is twofold. It is the origin of the disease and a primary focus for diagnosis and treatment. Understanding how it works helps us appreciate the importance of medical procedures like biopsies and transplants. Always remember, if you or someone you know is dealing with leukemia, consulting healthcare professionals is the best step to get personalized and accurate care.